In Conversation with Terry Shepard, award-winning broadcaster, narrator, and author. A deep dive into the writer's craft with the artists and support systems who create the stories we love.
Today's guest is someone who has spent her life listening, not just to symptoms, but to silence, to sorrow, and to the unspoken truths that live in the human brain. Dr. Carolyn Larkin Taylor is a neurologist with decades of experience, and now she's turning her stethoscope inward in a powerful new memoir, Whispers of the Mind. Through a series of deeply personal essays, Dr. Taylor takes us behind hospital doors and into the moments that defined her, from the crushing task of declaring a teenage boy brain dead to the quiet redemption of caring for her estranged father in his final days. With compassion, candor, and a poet's eye for detail, she invites us to consider the weight of every diagnosis, the grace in every goodbye, and the fragile beauty of the mind itself. Dr. Carolyn Larkin Taylor, welcome to the conversation.
Thank you. Thank you for that beautiful introduction.
What inspired you to write the book?
I wrote the book for two reasons. One was, first of all, I journaled this over the many years of decades of practicing neurology just for catharsis, just to deal with these really difficult situations that were both interesting but heart-wrenching. And then I decided to write the book because some of these stories were so inspirational. I wanted to share these with other people. And also, it's a book about the human spirit, about true medical stories really is what we remember at the end of the day. It's the true stories. It's what teaches us, and it's what makes us feel like we all are part of one common humanity. And the heroes of my books really are the patients, because they just displayed such tremendous courage. And they taught me along the way. They taught me just by being their physician. I learned from every one of them.
What drew you to neurology? Why did you want to become a brain doc?
It's complicated. I always was fascinated and interested in medicine. And the kind of personality I am is very instinctive, intuitive. I'm an introvert. I'm a listener. I love people. And when I first went into medical school, I had been an optometrist first. And I loved it, like the dealing with patients, but I was some ophthalmologist. I can remember spending a little time at Wills Eye Hospital in Philadelphia. And someone came up to me, one of the ophthalmologists, he said, "Why are you going to medical school?" He said, "By the time you finish, you're going to be 40. I'm going to be 40 anyway. I'd rather be a 40-year-old physician than an optometrist. I think that's more what I really want to do." And so when I got to medical school, I was open to everything, but I thought I was going to be drawn to ophthalmology, obviously, because of my background. Optometry is actually a 4-year doctorate degree program, so I had a lot of training and 3 years of practice. And then when I got there, of course, you do various medical elective rotations, and I was turned off by the surgery, and it seemed repetitive, and gee, what am I going to do 5 days a week, cataracts every single day with every patient, and my afternoons in an office will be very much like what I was doing before. So when I was exposed to neurology, I just absolutely fell in love with it. I loved everything about it. I loved studying the nervous system and the brain and putting together the pieces. A neurologist is like a detective. So it's so complex, and your personality and your maybe psychiatric issues or emotional issues play a big role in sometimes how your brain functions and how you present with disease. And I just loved it. And I read the textbook from start to finish, and I just had to be a neurologist. It was like I was just drawn by a magnet. And it was something I never thought I was going to go into, but I did. And I spent a lot of time in residency doing electives in neuro-ophthalmology because I had a natural background in that. And that led me eyes in a brain. And one of the diseases that has a profound effect on the eyes is multiple sclerosis. So I was naturally drawn to that. And in private practice, my practice grew so quickly with multiple sclerosis patients because the word spread in the area that I love to see that particular disease, and they just flock to me. And you deal with optic neuritis, you deal with double vision. And I had a very large practice of MS patients, which was very satisfying because we can actually do something for them. With neurology, so much is neurodegenerative, and we hold people's hands and we help them palliatively, but we don't have a cure. And we don't have a cure for MS, but we can sure do a lot to prevent people today from going on to progress. But I can never do just that because I love all of neurology. It's a fascinating field, and you get to really know your patients and you see them. It's not an orthopedic surgeon that fixes a hip and then they're gone. You see them every 3 months, every 6 months, depending on what's wrong with them, and you get to know them, you get to know their families. People are coming back to you for 20 years for their MS follow-up or that Parkinson patient, and try to encourage them to keep going. And I just found that extremely satisfying.
You write about the heartbreak of delivering devastating news. How does a really good doctor prepare herself for those conversations?
I learned a lot in my residency. I was in a fabulous residency program at the University of Pennsylvania. And we had some of the best professors, I think, of any program or one of the best programs in the country. And I learned a lot from them. I spent time with them. When they had to deliver a diagnosis of ALS, they would have you sit in, who's ever rotating with them that month, and they'd say, this is how you do it, and this is how you have to listen to the patient and understand what they can handle. And so I learned a lot, I watched a lot, and then when it was my turn, again, the patients teach you, you have to listen. You have to understand that I talk about, for instance, with ALS, I talk about maybe 3 different cases in my book, how each of them were different. You have the patient that comes to you and they're very medically sophisticated, and from their questions, they've read up on it. And this is what they're afraid of, but they don't actually mention the name of the disease. And they mention all other kinds of things that I think I've had a stroke, and I think it's this, and I think it's that. And you know how hopeful they are, and you don't rip that away. You listen to them and you say, they're all very good points. If we're going to start with the complete exam and do every test imaginable, so when we have a diagnosis, we're sure. Knowing that I'm not losing any time by spreading it out a little bit, because I know what they have usually at that point, and I'm not going to hurt them, but I'm going to give them a chance to accept the diagnosis personally on a soul level, even though maybe consciously they're not thinking out loud that this is going to be something devastating. And then you hear them when they come back in, and you go through all the test results, and it's not this and it's not that. And then you ask them, do you have what is it you're afraid of you have? And you wait to hear them tell you, this is what I'm afraid of, and this is where I thought this was leading. And then you say, yes, I'm sorry, but this is, and you try to put it in the most compassionate terms you can, that there are research still being done and there's a lot we can do to make you comfortable. But you also have to be there to answer the difficult questions when they come back a few times later and they talk to you about the fact that their family doesn't understand and their family won't talk about it to them, and they need somebody to talk to. And then you go into the conversations about end-of-life care and whether or not they want a feeding tube and a respirator, and you have to deal with all of those things, but not until they're ready, because it's just overwhelming for these people. But they display enormous courage. In almost every case I presented, these were very courageous people. And there are stages, as everybody knows today, from Elizabeth Kubler-Ross, of acceptance of death and disbelief and anger and begging God, and I'll do this, I'll be good if only you take this away, and then finally acceptance. And you go through those stages with them, and only when they are at the stage of acceptance, usually, do you start to talk about the difficult things that sometimes her family doesn't want to hear. But overall, I think a lot of the families become very accepting and helpful. And so it's a learning curve. You learn from each person, and each person is different. Some are angry at you the moment they come in, because I had a patient like that I discussed. I was not the doctor she wanted. I was the newest doctor in the practice, and I was young at that point, and she wasn't going to believe anything that I said to her. And she just went after me and after me and after me the first visit. What could this possibly be? Name all the possible things this could be. And she jumped on that diagnosis and then took it from there, that I didn't know what I was doing. And I realized she was angry and she needed somebody else. She needed somebody that was older. She needed somebody more experienced to take her down that road. So I helped her find that person. And so every case is different. Every person is different. But if I could do it all over again, I wouldn't do anything different. I would be a neurologist again and again. If I get reincarnated and come back in another life, I think I'd like to be a singer, but I don't have a voice. I think that would be fun in another life. But in medicine, I would be a neurologist. I think it's the most fascinating area, most fascinating field in medicine. But most medical students don't want to do a neurology rotation. And most people in medicine hate neurology. If it even smells like neurology, send it to the neurologist. We don't want to deal with this. It formed a bond because they knew I loved taking care of them and taking care of the things that were wrong with them, and that I would do my best no matter what.
Carolyn Larkin Taylor is our guest. The book is Whispers of the Mind, a neurologist's memoir. Memoirs are often deeply vulnerable. What was the most challenging part of writing the book for you?
I think as a novice to this, the most challenging, and I did a lot of workshops and things in memoir and read a lot, was making myself vulnerable, because I'm used to being the person taking care of someone else and not showing anything about my personal life, because it's not about me, it's about the patient. And we're even encouraged not to be on social media with patients. You have to have that professional boundary. And in a memoir, you have to share more about yourself, and I had a very difficult time trying to share how I felt when I was dealing with these devastating cases, what effect it had on me. And I think what helped me in writing this was sharing the experience that I had with 3 family members of my own that died of neurologic disease. So because it was neurologic disease, I felt it belonged in the book, but it was deeply personal of how does a physician make the decision to end life for a parent that they deeply love and don't want to lose, and how to be merciful, and how to guide the rest of my family. As the only physician in the family, they looked to me. At one point, I had been doing a neurology residency for 4 weeks. The others, I was a seasoned neurologist by then. But it's heartbreaking in a deeply personal way. And the grief that goes along with that, you're trying to manage the grief and keep going. That was especially hard for me in the beginning with my mother, who died an untimely death. I almost left medicine because of it. It was just so devastating to me. She'd been fine, and I was only doing this for 4 weeks. And it was a case of being in a hospital, a community hospital, where she wasn't treated well. She was put on a blood thinner, and the values weren't watched, so it became too high, and she had a massive intraperitoneal bleed and went unconscious. And that was her demise. She infarcted her brain, she infarcted other organs, never to regain consciousness again. Her abdominal pain she complained of was ignored because she was a woman, because she was older, I don't know, but it was ignored. Were they too busy? I don't know. But suddenly I was hit with how imperfect medicine is. And doctors are human too, but I lost my mother. And my mother and I were very close. She brought up 4 children all by herself. As you can imagine how close we all were to her. And so I was devastated by this. And so she died on a Friday. We buried her on a Saturday. She was in the ICU after the critical event for 5 days. And then Sunday I was on call. I had to go back to the hospital on a resident. And they understood, but they weren't that thrilled that I was out for 5 days, because everybody else has to pick up your slack. And so I went back and the consults started coming in. It was a Sunday and I had to sign the neurosurgical resident because we covered each other's services. I had to sign out to me and his patients that I would be covering for the day. And I thought I can handle this because the very first of all the consults I got, there was one that was double vision. And I thought that'll be a cinch for me. I'll just go do that. And once I get going and I'm in the groove, I'll be fine. And so I went in to see this older gentleman. And before I even got started, he started yelling at me, "What's a woman doing in here? I don't want a woman. You're a woman. I want a male. What makes you think you can evaluate my double vision?" I was not in a good place. So I let him have it. And I said, "I'm just as qualified as anybody else. And who do you think you are questioning my qualifications? And I'm probably more qualified than your average neurology resident because I have a lot of training in the eye." And I ran out and ran to the nearest restroom, and just sobbed and sobbed because I was grieving my mother. And all I needed was for somebody to attack me first thing in the morning. And I couldn't get out of the restroom. I couldn't stop crying and I couldn't get out. And I knew I needed to go apologize to this patient. And the neurosurgical resident, the poor guy, was trying to find me to sign out to me. And he paged me and paged me. I was crying so much I couldn't even answer my pager. So finally he heard me and knew what room I was in. And he knocked on the door and I told him what was wrong. And he was so nice. He said, "Look, you shouldn't have even come in today. You go home. I'll take your patients. Don't worry." He was so nice. And I did go home only to come back the next day. And on my way out, I went and apologized to this man and told him it was the grief over my mother and I really apologized. He said, "I was mad at you because my son is married to a physician and I resent her because she's a physician and I just resent her and I took that out on you." And so we parted friends. But I had a hard time for months and months. Every time I saw an older woman in the intensive care unit, which I was there a lot, I saw my mother. And I just didn't want to do that, didn't want to be there. A few months later, I applied for an ophthalmology residency because I thought, we'll be dealing with death and dying there. And I got accepted into a new program. And as time went on, I was getting a little bit more over the grief and I really fell in love with neurology again. And I said, "No, I'm staying and I don't want ophthalmology." I never did. And then I went on and I was able to keep going. But I think the whole experience made me a more compassionate physician, especially with families, because I intimately knew what they were going through.
In time, we all become caregivers and we all have to usher loved ones to that next level over the bridge. How does somebody like you care for your own mental and emotional health?
There's so little time. I was a resident and you're working sometimes 80 hours a week. I had a little boy at home, a marriage, and I was trying to do it all. That you have to save yourself for, I have to function at work and I have to do the best job I can. And every moment I'm home that I can stay awake, I want to be a mother and I want to be there for my little boy. I think my husband got the short shrift of all this because I knew he would understand and I could ignore him. But there isn't any time to process your feelings or deal with this. And that's why I journaled. I started journaling way back then, not every night, but every difficult case. I would, instead of crying or there's no time to see a therapist or see anybody to talk to. And we had each other as residents and we pass each other in the halls and talk about this difficult case. But we're on the way to see another case. And in residency training, so much of it is inpatient hospital and not so much outpatient. At least as an outpatient, you get to see headaches and epilepsy and things that you can treat. But inpatient, it's a lot of brain death exams from overdoses, from trauma, devastating strokes, brain cancer. So the inpatient neurology is what really is the hardest part emotionally. And as a resident, that's almost all you're doing. So I think the residency and internship were more difficult. In private practice, you had a break. They seemed just a lot of routine things, and that's so much easier on your psyche. And you have so much more time then to be a mother and be a wife. And you never feel like you're doing anything. You want to do everything the best you can. And if I had done things right, I would have done training and then married and then had a child later on. But it all just happened at once. And somehow it works. My husband was wonderful in helping take care of things. He was a dentist, new in practice, so he had a busy practice. And we had these wonderful European au pairs that lived with us. So I could trust them, and I could walk out while my son was still asleep without having to drop him off at daycare. And both of us had odd hours, so they were wonderful. And fortunately, the pregnancy went well, and my son was healthy. There was a few little things here and there where he got sick, but we just had a lot of help, and the residents helped each other, and it all just somehow worked out. But I was very lucky, and I never missed a day after those 5 days. I missed one day on a weekend. My son was in the hospital, but he was right home. And I was just very lucky, because you want to be able to be there and not be a burden on your fellow resident. And at the same time, you want to be there for your child. But I used to, when my mother was still alive, when I was an intern, I used to call her up on the phone. I had a really young infant. He was under a year, because I had him in medical school. And I used to I'd be overnight on call, and I missed him. I wasn't there to give him his bath or read him the stories. And I'd call my mother and say, I just can't go on any longer. I don't want to miss him. I didn't know it was going to be like this. And she used to just say, he's going to be fine. You're the one that's suffering right now because you miss him. But trust me, he's going to be fine. He's with people he loves. You're there with him every moment. And he's going to need you so much more when he's older. And by then you'll be a practicing physician, who'll be more in a position to help him when he needs you and be there for him. And she was right. And she was like my rock. So when I lost her, it was really hard. And I dedicated this book to her.
Dr. Carolyn Larkin Taylor is our guest. It's a fascinating conversation about Whispers of the Mind, a neurologist's memoir. The brain is often called the body's final frontier. What fascinates you most about that, even now?
Oh, it is the most fascinating organ in the body, because there are so many mysteries. There's still mysteries. When I started training, we thought there was no plasticity in the brain, that you had all the brain cells you're ever going to have when you were born. And once you lost those cells, it was gone. And you did rehabilitation with people after strokes and brain trauma, but you didn't expect it to get them very far. But now we know there is a lot more plasticity to the brain. We've learned so much more, and there's so much more hope that we're always learning something. There's always a new procedure. There's a blood test now that's just approved that can help diagnose Alzheimer's. That's very similar to a spinal fluid test that we do. And it used to be, you could only diagnose it with the brain biopsy. There's so many more drugs. There's so many more immune modulating drugs to treat conditions within the brain, that it's just, I think, the most hope for breakthroughs in neurology than ever before. I remember when I was an intern and a medical student, people used to tease me about going into neurology. Why would you go into neurology? All they can do is give people aspirin or steroids. There's just nothing else you can do. And that wasn't too far from the truth 30 years ago, but it's far from the truth right now. And I have loved growing with neurology and watching all the advances and being able to take advantage of it, and the continuing education. And it's a lifelong learning process.
What kind of things can we do to keep our brain supple as we age?
You've heard this from everybody. Good diet that's low in inflammation. Exercise. Exercise, for instance, something like Tai Chi, helps use pathways going to the brain that are in your spinal cord, in your peripheral nerves, and your brain itself. Pathways that were there and established maybe in infancy that perhaps you haven't used because you haven't done those kind of movements. learning something new, like trying to learn a new language or learning to play a musical instrument, but you're using pathways that are there and established that have perhaps never been used, and you open them up and you sprout new areas of growth and you use more of your brain. We only use a small percentage of our brain power every day, and you're using power, you're using pathways that are there anyway that you've never used before. And it's been proven to help us stay young.
What do you hope readers both inside and outside of the medical profession will take away from Whispers of the Mind?
Not just a story of neurologic disease. Neurologic disease is interesting, and I tried to pick the most interesting types of cases I could. But anybody can read about a textbook definition of Parkinson's disease or stroke. That's one thing. It's another thing to actually see a true life story, as if you're walking with the patient in their shoes, because that's what sticks with you. And that helps remind all of us of our own common humanity. We're all human. We all can feel these things, and we all draw inspiration from the courage of others. So it's about neurology, but it's also about mostly the human spirit and the sense of belonging we have to each other.
It's a fascinating read. The book is Whispers of the Mind, a neurologist memoir. I highly recommend it. You will walk away from your encounter with Dr. Carolyn Larkin Taylor changed from reading this book. Her website is carolynlarkintaylorauthor.com. That's where you can find the book, and that's where you can learn more about our special guest. Thanks so much for the conversation.
Thank you. Thank you. I really enjoyed talking with you.
In Conversation with Terry Shepard is a copyrighted presentation. All rights reserved. I'm Lisa Davis. Join Terry Shepard next time in Conversation.